Okay, next I'm going to be assessing your skin. Your color is even and appropriate to ethnicity. Skin is supple and non-scaly. Temperature is warm to touch, and skin is smooth. No visible lesions or wounds that I can see, also no incisions. I'm going to now inspect and touch your face and your head and neck, okay? So I'm going to start with touching your scalp. Just make sure that there's no lumps, bumps, or lesions. Overall shape of your head is symmetrical. Hair distribution is normal. And I'm just going to have you look up, all the way up, and look all the way down. And then I'm going to have you go back to normal, look side to side. Any pain with any of that?
No.
Okay. And then I'm going to press on the temporal artery, check for a pulse, and I feel a pulse. TMJ, I'm going to have you open your mouth. Okay, and then close, and then go side to side. Any pain with that?
No.
Okay, sounds good. And then with the rest of this, just let me know if you do have any pain. Sinuses, I'm going to first touch your maxillary sinuses. Any pain with that? Okay. And frontal. Any pain with that? Okay. And then your lymph nodes. So I'm going to start here under your chin and test all the way down your neck. Any pain with that? Okay. Trachea. Just going to press here. Okay. And then the thyroid gland. Everything looks good. No nodules or abnormalities. Trachea is symmetrical. And then muscle strength. I'm going to have you push your head to my hand. Good. Push your head to my hand. Good. Any pain with that? So now I'm going to do the eye assessment. I'm going to be using this light here. Good. Eyes are equal, round equal in size, round, reactive to light. And then I'm going to check accommodation. So take a look at the pen light here. Good. Bilaterally, your eyes are accommodable. And then I'm going to do the cardinal gaze. So take again a look at the pen. I'm going to go up here. Just follow the pen. Good. Everything looks normal there. And then the visual field, I'm going to have you close or cover your eye with one hand. Take a look at me, and then just tell me when you can't see my pen light anymore.
No.
Okay, good. And then I'm going to have you do the same with the other eye. And again, just tell me when you can't see my pen anymore.
No.
Okay, good. And then we're going to use the ophthalmoscope to inspect your eyes closer. So we will do that at a later time. And then we are also going to check your vision acuity with the Snellen chart as well.
Okay.
All right. Okay, now we're going to do an ear assessment. So I'm just going to look in your ears. We're good. I'm going to touch them. Good. Okay, any tenderness with that? No, good. There is no drainage or tenderness to the external ear. Ears are symmetrical to face, no abnormalities. We will be using the otoscope to examine each ear canal and eardrum. And then the voice test. So what I'm going to have you do is I'm going to have you stay where you are. I'm going to have you cover this ear here. I'm going to step away. I'm going to say something, and then you just have to repeat it to me. And then we're going to have you turn, and we're going to do the same thing with the other ear. Okay, so I'm going to have you cover your first ear. Good. 1, 2, 3.
1, 2, 3.
Good. And then I'm going to have you turn. Yeah, we'll do. I'll just that's fine. And then I'm going to have you cover your other ear. Good. And then again, repeat what I say. 4, 5, 6.
4, 5, 6.
Good. Okay. And then, Okay, so now I'm going to do the Weber test. I'm going to strike my tuning fork and put it to your forehead, okay? Which ear do you hear this out of?
Both.
Good. Okay, and now I'm going to do the writing test. I'm going to strike the tuning fork and put it to your ear and then touch the back of your head as well, okay? Tell me when you can hear this.
Yeah.
Okay. I'm going to hit it again. Tell me when you can hear that.
Yeah.
Okay. Tell me when you can hear it.
Yes.
Okay. And can you hear it?
Yeah.
Okay. Good. And then we're going to do the nose next. So do an assessment on your nose. Overall appearance for the external nose, no lumps, bumps, or lacerations noted. Can I have you breathe out of your nostrils? Good. Okay. Both nostrils are patent. No discharge or obstruction to be seen. Okay, good. No deviation of the nasal septum. Nasal mucosa are pink and moist. Then we're going to have you do the smell test. For this, I'm going to have you close your eyes. I'm going to have you cover one nostril. Good. And then I'm going to have you smell this. Tell me if you can smell it.
Mm-hmm. Yes.
Okay, good. And then cover your other nostril. Good. And can you smell this?
Yes.
Good. Okay, you can open up your eyes. Thank you. The final assessment is the mouth assessment. So I'm going to use this light. I'm going to have you open your mouth, stick your tongue out. Say ah. Good. Okay. So the tongue is pink, moist, with no lesions. Uvula is midline and rises equally. Oral mucosa is pink and moist with no lesions. Tonsils are 2+ with no redness. No dentures noted. Teeth are present with none missing. This does conclude our head to neck assessment. Do you have any questions or concerns?
No.
Okay, sounds good. Thank you. I'm going to wash my hands now and we are done with the head to neck assessment.